I'm a labor and delivery nurse, and let's go through the top 3 things that I would have on my birth plan if I was going for a scheduled C-section. It's also a really good idea to have a birth plan for a C-section just in case, because anytime you are going into labor, there is still a risk that you might have to have an emergency C-section. So number 1, I would definitely do skin to skin in the operating room and have a birth partner there who can also do skin to skin. That way, if you're not feeling your best, if you're feeling nauseous and you're vomiting, or you're really shaky, or worst case scenario, you have to be put to sleep during the surgery, someone is there who is ready to do skin to skin with the baby right after they come out. Number 2, I would want to make sure that there's still delayed cord clamping. So this means waiting 1 to 2 minutes after baby has come out before cutting the umbilical cord. This is something that you can still do in a C-section as long as baby comes out crying and is happy. If they're concerned with baby at all, just like in a vaginal delivery, we will cut the cord a little bit sooner. But if baby's doing okay, I would prefer to wait about 60 seconds before cutting the umbilical cord. That way baby gets all the extra blood flow from the umbilical cord before it's cut. Number 3, I would like all of the baby's measurements and weights to be done after the C-section is complete. So a lot of times the baby's weight and measurements are done in the operating room, and I would prefer this to be done about an hour postpartum once I'm in the recovery room. That way I could be a part of it. When I'm on the operating room table, I don't think I will be able to concentrate on seeing the baby's weight and taking pictures. Just for me personally, that's something that I would really like to be a part of, and I know that some of my patients would like to be a part of as well. And there's really no downside to waiting an hour after baby's born. I also want to preface this by saying a birth plan is just a preference list and something that you can research ahead of time. It's just something to give you a little bit more information and things that you can advocate for yourself when the time comes. It most of the time doesn't go to plan, but it's just something that you can research ahead of time and hopefully give you a little bit more comfort going into the labor process.